Just firstly, it's such a privilege to see all of us together as a room of multi-stakeholders. I see consumer leaders, I see health professionals, manufacturers, Polish hosts, and it's a privilege to be together, firstly because we all believe and subscribe to tobacco control, but I think all of us also have seen the light in what harm reduction can do if that is joined to tobacco control. So perhaps just 3 words as you read this very important report. Congratulations, Marewa, and the rest of the co-authors. But firstly, the word is replication. Number 2, experiment. And number 3, speed. So just firstly on replication. This report shows that what the Swedes did over many decades can in fact be replicated in other countries. To do just that. Both were staunch tobacco control experts as countries, but the Swedes embraced harm reduction some decades ago by making sure that non-combustibles were made affordable and accessible and acceptable to Swedish consumers. It's so simple. And New Zealand, if you look at their story and if you see the graph that Marewa showed us, same story. The government first banned it, and then they turned around and they said, well, why not? Let's regulate it and see what happens. You saw what happens. So the replication is possible from Sweden to New Zealand, but our goal must be to try and reach the 194 member states of WHO so that they can all look at this model and see, is it replicable in their country? The second word is experiment. If you think about it, Sweden and now New Zealand, and Colin, Australia, are some of the largest naturalistic experiments live, underway in their countries, where different governments have tried different regulatory approaches, and you can see in the smoking prevalence and then in the health outcomes how the different policies have worked out in the indicators that matter. And we've been in tobacco control, many of us, for many years. Ultimately, it's always to prevent and control smoking-related death, premature death, disability, and disease. Look at the stats of New Zealand, and that's what we try to do in this report. Look at the disability-adjusted life years and how much fewer years are lost in New Zealand because the government has made the right policy choices. Likewise in Sweden. Why would Sweden have 41% less cancers than the rest of the EU? And you remember Anders mentioned total nicotine use in Sweden is equivalent to the rest of the average EU countries, but they have much better health outcomes and a much lower smoking prevalence. So simple. So this kind of naturalistic experiment is extremely important. I see David Sweeney in the room, and David would say Japan should be added to the list. Where in the world has a country over the last 5 years managed to convert 50% of their combustible cigarette smokers to a non-combustible form of nicotine delivery? So these large naturalistic experiments need to be deeply studied. And as Clive Bates would always say, the sky should be darkened with aeroplanes of epidemiologists and public health experts coming to see what has happened in these countries. But then the last word is speed, and to me that's the most important. We can have these conferences for the next 10 years, but as long as we have the conferences and we don't have the other 194 member states come on board with harm reduction, we will lose lives. So as we're speaking, the clock is ticking, and lives are being unnecessarily lost. And if you now look at what happened in New Zealand, and specifically the graph of how smoking prevalence suddenly dipped when the government approved risk proportionate regulation, taxation, labeling, and communication, this is obviously the formula that should be followed. And that's what I hope this report can do through Marewa, Colin, and the other co-authors of this, is just to connect the dots and to make sure that there is renewed research, renewed interest, and awareness of quit like Sweden, quit like New Zealand. And maybe just the last word on the word quit. So we as physicians, we always spoke about quit or die to our patients, which is criminal actually, if you think about it. But what has been expanded in the Quit Like Sweden, Quit Like New Zealand, is the definition of quit. We've always said quitting means no cigarettes for 6 months. But what's happened in these countries? There's been a switch. Consumers have switched from combustible, dangerous stuff to non-combustible, smoke-free nicotine alternatives. That's the key. That's absolutely the key. So let's please, all of us, become advocates for Quit Like Sweden, Quit Like New Zealand. And long may this last. Thank you, Maria.